Obesity treatment costs, Turkey versus Scandinavian countries. Obesity is a growing epidemic worldwide, with rates on the rise in both developed and developing countries. The cost of treating obesity can vary significantly from country to country, with some nations spending more on healthcare for overweight and obese individuals than others. In this article, we will compare the costs of obesity treatment in Turkey with those in Scandinavian countries, known for their high-quality healthcare systems. Turkey has been experiencing a rise in obesity rates in recent years, with around 32% of the population considered overweight or obese. The cost of treating obesity in Turkey is estimated to be around $1.5 billion per year, with the majority of this cost going towards treating obesity-related diseases such as diabetes, heart disease, and hypertension. The cost of obesity treatment in Turkey is primarily covered by the government through the national healthcare system, with individuals also having the option to purchase private health insurance for additional coverage. In contrast, Scandinavian countries such as Norway, Sweden, and Denmark have lower obesity rates compared to Turkey, with around 20 to 25% of the population considered overweight or obese. The cost of treating obesity in Scandinavian countries is also significantly lower than in Turkey, estimated to be around $1 billion per year combined for the three countries. This lower cost can be attributed to the high-quality healthcare systems in Scandinavia, which focus on preventive care and early intervention to reduce the risk of obesity-related diseases. One of the key differences in obesity treatment between Turkey and Scandinavian countries is the approach to prevention. In Turkey, there is a lack of emphasis on preventive measures such as nutrition education, physical activity promotion, and weight management programs. This results in a higher number of individuals developing obesity and requiring costly treatments for obesity-related diseases. In contrast, Scandinavian countries have implemented a range of preventive measures to address obesity, including school-based nutrition programs, workplace wellness initiatives, and community-wide campaigns to promote healthy lifestyles. Another factor contributing to the lower cost of obesity treatment in Scandinavian countries is the availability of quality healthcare services. In Turkey, there is a shortage of healthcare professionals, particularly in rural areas, which can result in delayed diagnosis and treatment for individuals with obesity-related diseases. By comparison, Scandinavian countries have a higher number of healthcare professionals per capita, as well as well-equipped healthcare facilities that can provide timely and effective treatment for patients with obesity. In terms of healthcare expenditure, Turkey spends around 5 to 6% of its GDP on healthcare, with a significant portion of this cost going towards treating obesity-related diseases. Scandinavian countries, on the other hand, spend around 8 to 10% of their GDP on healthcare, with a smaller proportion allocated to treating obesity. This higher healthcare expenditure in Scandinavian countries allows for better access to healthcare services as well as more comprehensive coverage for obesity treatment. Overall, the cost of treating obesity in Turkey is higher compared to Scandinavian countries due to a lack of preventive measures, limited access to quality healthcare services, and high healthcare expenditure on obesity-related diseases. To address this disparity, Turkey could benefit from implementing similar preventive measures and investing in its healthcare system to improve access to quality care for individuals with obesity. By doing so, Turkey can reduce the financial burden of obesity treatment and improve the overall health and well-being of its population. In conclusion, the cost of treating obesity varies significantly between Turkey and Scandinavian countries, with the latter having lower obesity rates and healthcare costs. By implementing preventive measures, improving access to quality healthcare services, and investing in healthcare infrastructure, Turkey can work towards reducing the financial burden of obesity treatment and improving the health outcomes of its population.